good morning to everybody watching. Thanks to all our sunrisers for being here. Everybody on YouTube, please remember to hit the like and subscribe button. And when you do so, please do remember to spread the word. I want to say good morning to everybody who is not feeling so well this morning, all right?
Yeah.
Sending you lots of love, lots of good vibes, and lots of great energy.
Most definitely.
Yeah, all the persons who are in the hospital right now watching, good morning to you. We're hoping that everything will work out to your benefit and God will continue to bless and heal you, all right? So thank you so much for joining us. And we are always on the sunny side of your TV. Now, we can't stress enough that your health is your wealth. And so, Dr. Kevin Henry, a highly accomplished obstetrician and gynecologist with over 12 years of experience in the field of medicine, is here with us to highlight Cervical Health Awareness Month. Everybody know about cervical cancer and all that stuff and pap smears and all that stuff. Well, guess what? He's here to delve into all of it. Sir, welcome, Doc, to Sunrise. How are you?
Fine, thanks. Thank you for having me.
Very well. Welcome. Now, Cervical Health Awareness Month. I've known about, aware about pap smears and stuff, but I didn't know there was a month dedicated to it.
Yeah, so it's really Cervical Cancer Awareness Month. So January is the month where we, choose to highlight cervical cancer, the risks that are associated, and trying to get everybody just more aware in general of what it's about, how it affects our population, how it affects our women, and what we can do to try to prevent and to protect against cervical cancer and to try and reduce that health burden in the country.
Well, delve into it, Doc, and let us know. Cervical cancer, cancer of the cervix, what are the risks and how can we protect ourselves?
Right, so cervical cancer is cancer of the cervix. The cervix is really the neck of the uterus or the womb, as many persons would know it. And a cancer is really the development of abnormal cells in any particular organ of the body. When those abnormal cells grow and spread, then it can reach to other places and metastasize or reach to other organs. So cervical cancer is actually the second most common female cancer in Jamaica. Behind breast cancer. So we can see that the burden of disease is pretty high. And so there are other things that can increase the risk of developing cervical cancer. The primary one is HPV, or human papilloma virus. So HPV is an extremely common virus that is spread through sexual intercourse. So anybody that would have had sex before, more than likely would have been exposed to HPV at some point in their lifetime.
And men can have it and women can have it?
Men can have it and women can have it. So that is how it's interchanged pretty much.
Right.
So HPV, though spread through intercourse, is usually cleared by your immune system. So in the same way that you can catch a cold or a cough and your immune system will take care of it and you're fine, that's what normally happens with HPV. However, if it persists and it's not cleared and it stays there for a long period of time, it can then lead to abnormal changes on the cervix, which can then over time lead to cancer.
Wow. So we've noticed that correlation between HPV and the development of cervical cancer. Some years ago, because of this connection, I remember when there was a big discussion in Jamaican society about administering the vaccine,
vaccine
to girls in, I think, maybe grade 7 or something like that. Where are we where that is concerned, and how much of a change have we seen in the way that the virus has presented itself?
So yes, I remember that very well. I actually worked with the ministry at that juncture a couple of years ago, helping them to promote the vaccine. So there are different strains of HPV, right? Over 200 strains of HPV.
Yes.
Those are now broken down or categorized into low grade and high grade. So the low grade strains are the ones that can cause genital warts commonly in both men and women. The high grade strains are the ones that can lead to the abnormal cells that can become cancerous. So there are more common strains that usually cause cancer, specifically type 16 and 18. So what the vaccine does is that it prevents against those, well, some of the low grade, but primarily the high grade strains that can cause cancer. So the aim of the Ministry of Health at that time, and still now, is to try to get young girls vaccinated at an early stage, even before they've ever been exposed to having sex, which is why you get exposed to it.
Right.
Hence why they wanted to administer it like
high school,
early in
yes.
high
Correct.
school.
So the time period for that is really from ages 9 to 14 to try and catch them at that early period before you've ever been exposed to it.
Right.
And it works just like any other vaccine where you're exposed to a small amount of a replica of the virus, which then gives you immunity or protection, antibodies, which protect you for life, essentially.
So let me ask
we
you that.
benefited?
So I wanted to find out,
Sure.
in terms of benefiting, but you talked about from, before they're exposed. What about women who are already sexually active? Would the vaccine work in the same way, or does the vaccine have the same efficacy in women who are already sexually active, but I just heard about the vaccine and doc, I want to take it now?
Right, yes. So it still has a good amount of efficacy even if you are sexually active or have become sexually active already. And the reason for that is that you have the different HPV strains, so you may not have been exposed to that HPV strain, 16 or 18, or many others, because the newest vaccine, which is Gardasil 9, covers up to 9 strains of HPV. Previously, it was only 4 strains that they would cover. And so with that increased coverage, even if you've been exposed before, it doesn't mean that it has affected your system negatively, you know? So previously as well, the age for coverage was up to age 26. That has now been extended based on research, and we have more data now to age 45. So you'll have a lot of women coming into the clinics or coming into office saying, hey doc, boy, I'm 28 now, I'm 30 now, I'm 35 now, my time for the vaccine gone. So no, it's actually up to age 45 now. So there is tremendous benefit in still getting the vaccine up to age 45.
And it's 2 injections still?
3.
3 now.
3.
Okay, so tell me, how do we take it? Because I remember it's like you take 1 now, then 1 4 weeks later, or 8 weeks later. Is that still the same?
Right, so for the Gardasil, you get 1 now, and then you get the second dose 2 months later, and then you get the third dose 4 months after that. So
and you're protected.
And then you're protected. So it's 0, 2 months, 6 months.
Okay.
But there is still good coverage if it is that you had only gotten 2 doses. So if you got 1 at now and then the second one 2 months, you still have good protection if it is that you didn't get to receive the third dose.
Doc, let's say that a woman has just done a PAP and there's an abnormality that has been identified, because that's why you do a PAP. I mean, she's panicking. What would you say to that person? What would you say to her spouse? In terms of the next steps, because it's a very crucial moment.
Sure. So abnormal pap smears, you have to break it down as well into what the abnormality is, right? Because a lot of times persons will hear, oh my God, my pap smear is abnormal. What is
but not every abnormality needs to raise an alarm.
Correct, correct. So we can break it down again into, so how I like to explain it to my patients, you have normal over here, you have cancer over here, right? Anything between normal and cancer is considered abnormal. For it to move from normal to abnormal to cancer, though, is not an overnight thing. So it's not that today you're normal and then tomorrow you're going to wake up with cancer. Usually that takes place over a number of years, sometimes up to 10 years, right? And so if we can catch anything in that abnormal space, then we're able to treat it way before it reaches over here to the cancer stage.
So essentially cervical cancer is preventable?
It is definitely preventable, and that is why there is such a big push to try and get the screening done for cervical cancer, which is by doing a pap smear, and also preventative measures, which include getting the vaccine.
Let me ask you, sir, because a lot of people, a lot of women, probably this is your first time this morning hearing about a pap smear. How often should we be doing a pap smear? And getting out there, the myths and the sayings, oh, it got hot, it got this, it got that. How easy is a pap smear to be done?
So pap smear is very, very easy to be done. It's offered everywhere, meaning all local health clinics, private doctors, general practitioners, OBGYN. So it's very easy and it's accessible to do a pap smear. So the recommendation is that for all women over the age of 21 and over, once they become sexually active, then they should have a pap smear done every 3 years, once you are considered low risk. If you are high risk in our population, it is recommended that you do a pap smear once a year. Generally speaking, we just do a pap smear once a year as part of your routine health screening, because what will happen is that if there's anything abnormal, obviously you'll catch it or you'll pick it up way before, right? So those are the current protocols now in terms of screening for a pap smear. There are a lot of myths, as you said, in terms of it can be painful, it's uncomfortable. You know, my mother did tell me, said this thing hot. And furthest from the truth, right? Once a pap smear is done properly and correctly, it should not be painful at all. You may feel a little bit of pressure, may feel some discomfort, but it is quick and easy, and it is important to prevent something from happening adverse versus you catching up when the horse done gone through the gate.
Exactly, and that's part of our responsibility as adults. But you are a very responsible doctor, and you are a great corporate citizen, and you care about your female patients. 100%. And so you are having free pap smears, I hear? Yeah,
so in my own way, in trying to help in light of Cervical Cancer Awareness Month, this month I chose to do 100 free pap smears at the office.
Wow.
So anybody over the age of 21 who is desirous of doing a pap smear, we wanted to extend that to the end of this month.
Wow.
So far I think we've gone about 30-something, 40-something.
Yeah.
So this week is pretty booked up. We're just doing pap smears just to at least offer it. I don't want it to be that, you know, cost is a hindrance or anything else is an obstacle to get the screening done, and also to just raise the awareness of the importance of doing a pap smear.
Absolutely. Where are you located, and what are your opening hours?
So my office is Neo Medical, which is located at 76 Red Hills Road.
Okay,
the opening hours
across from Calabar High School.
Yeah, so it's the new plaza right across from Calabar.
M10 in it.
M10
is in the
Starbucks,
plaza.
everybody in
right, and then across from Calabar.
Right.
Okay, very well, yes.
And our opening hours are Monday to Friday 9 to 5 and Saturday 9 to 1.
Very well. So, ladies, is this my camera right here? Ladies, good morning to you.
Good morning.
Dr. Kevin Henry has been so gracious to offer a free pap smear. I want to encourage each and every woman to get up and go and get your pap smear done. Prevention is better than cure. Do not listen to the naysayers. Do not listen to people who are trying to deter you. Your health is your responsibility, especially women. When you have your children, you have your families who are depending on you. This is something that you must do. You must place it on your list of priorities. I know, as women, you know, we're often tasked with taking care of husband and child and mother and family and everybody else except ourselves. I am asking, I am beseeching, I am imploring each and every one of you to make your pap smear a priority. And Dr. Kevin Henry is doing free pap smears until the end of this month. If Dr. Henry is not your OBGYN, not a problem at all. Just go to your preferred OBGYN and get your pap smears done today. Get it done now. Delay is danger. And remember, you owe it to yourself to get your pap smears done. Okay? So, Dr. Henry, thank you so very much. And where can we find you on social media to get additional information?
Sure. So for me, it is at Dr. Kevin Henry, or you can go to @myneohealth.
Neo Health.
Correct.
All right. Thank you so much, sir.
Thank you for having me.
Yeah. All right. And if you know any female, by the way, call your female friends and let them know. You see, these are the things that we need to call our friends about, Dennis. Instead of call about people business, and for chat people, and for bring down people, and talk about mix up. These are the things. Girl, you know somebody that watched Dennis and Miss Kitty this morning? Pan Sunrise. I'm see one doctor name. Wait name again? Dr. Kevin Henry, yeah. And him say him do free pap smear. Yeah, girl. Make we go now. Make we take a lunchtime and go.
Yeah, absolutely.
Right? Just like that. All right. Thank you. Thank you, Doc. Neo Medical, right over there, across from Calabar, the plaza. M10 is in the plaza too. So make sure you get there, all right? We're going to take another break, and we'll be right back right here on Sunrise.